Hey guys, so I did the comparison of two pelvic positioning belt configurations in a pediatric wheelchair. A little bit about the abstract. Um, this is basically talking about maintenance stability for children in wheelchairs, particularly for spasticity. So we know that spasticity is when the muscles are continually contracted. There are a different number of attachment points between the seat and the belt. So this study compared a 4-point versus a 2-point pelvic positioning belt for the trunk fixation in 20 young patients with spasticity. And the results were that 70% of children require the use of pelvic belts. And the results said that better stability observed with the 4-point compared to the 2-point. So a little bit about the introduction. Um, Pelvic stability refers to the ability of the trunk and the hip/pelvic muscles to keep the spine and pelvis in optimal alignment during activity. Without pelvic stability, upper extremities function is restricted. So we know that instability limits comfort during fine motor function and ABLs. So the most common intervention for pelvic stabilization is pelvic belt. This prevents the pelvis from submarining. Submarining is defined as the slipping of the lap belt over the iliac crest of the pelvis, consequently loading and injuring the abdomen. So the belt is placed high across the thighs with a downward and slightly backward pull to prevent the pelvis from submarining. The point of attachment of the lap belt is less than 45 degrees and 60 to 90 degrees from the seaming surface. There is a need for more research and effectiveness on postural belt types. But basically, the main focus of the study is to quantitatively compare a 4-point and a 2-point pelvic belts using 3D posture analysis. So, the participants included 20 young patients with spasticity, 7 with spastic diplegia, 10 with spastic tetraparesis, and 3 with tetraparesis after a traumatic brain injury. The age range was 4 to 12, 7 girls and 13 boys. All the participants presented limited motor functions, currently using a wheelchair with a 2-point lap belt, and had no means of independent mobility. Participants were volunteers and their parents gave written consent. And they were evaluated at the Movement Analysis Laboratory of Scientific Institute. The experimental setup, so they were assessed with the gross motor function measure, the GMFM, and quantitatively assessed using 3D motion analysis. The GMFM standardized observational instrument measures motor function over time in children with CP. It measures the child's overall functional abilities and consists of 88 items divided into 4 sections. The 4 sections are lying and rolling, sitting, crawling and kneeling, standing, walking, running, and jumping. Each section contributes to the overall GMFM score. And the 3D posture measured using an optoelectronic system. Basically, this system performs a real-time processing of images from 2 or more video cameras to recognize in the field of view the presence of passive markers that can be fixed onto proper landmarks of the individual. So basically, it's a camera installed in the chair on the proper anatomical landmarks. And the assessments were performed in 3 settings. You had one without a seatbelt, one with a 4-point belt, and one with a 2-point belt. In each setting, evaluations occurred in 2 sessions. You had a pre-session and a post-session. And the parameters of interest that were tested were trunk flexion angle, knee joint angle, and ankle joint angle. So the results, there were no statistical differences found in the pre-session among the 3 settings. 6 patients needed no reposition after each post-session, showing good stability without pelvic belts. but 14 patients needed to be repositioned by the operator after the post sessions, showing a submarining in one or more of the 3 settings. So by repositioning, that the operator is the person that's driving the wheelchair and fixing them in their chair. The discussion. So basically, the major goal was to provide sitting stability through specialized seating devices aimed to stabilize the pelvis and avoid submarining of patients. The problem with this article is that little evidence is available to guide professionals in the proper use of pelvic positioning devices. So there's not much research out there. So the majority of the analysis come from interviews and questionnaires and observations. So this lacks empirical data. And 70% revealed low stability when no belt was present. And 8 out of the 14 patients revealed better stability with a 4-point compared to the 2-point belt. 3 children reported 2-point being better, and 3 children reported no difference in the belts whatsoever. But the 4-point pelvic positioning is more effective, particularly in patients with the lower GMFM values. That's that 88 question item divided into 4 sections test. But the 4-point belt allows greater area surrounding the thigh. So basically the main limitation to this study, again, like we said, is that there's not much research out there, so that you can't really compare other literature. And the small number of participants. So the article says to, maybe have more participants next time. But yeah, here's my reference. Thanks, guys.